Hey guys, I wanted to hop on and make a video. It's been a few months, 6 or 7 months since I've made a video. I'd like to first of all to really thank everybody that donated and participated in our raffle event, and all that money ended up going to my stem cell treatment that we went and had done in Clearwater, Florida, NSI. Unfortunately, I don't think that I benefited at all from that stem cell therapy. There was a chance, you can look up, there's so many success stories and it helping people that's had strokes and, all kinds of issues, MS. So I thought that there might be there was a chance that it could have helped me out even just a little bit. And because all of you donated, I was able to go explore that option. So me and my family were also so grateful for everybody that donated and participated in the raffle on my GoFundMe. With that being said, the last 6 or 7 months, I've really just been I've been traveling a couple hours away to Bowling Green, Kentucky to see a neurologist that specializes in the autonomic nervous system, Dr. Zia. He was a pretty good doctor. I really like the way that he approached everything. He sat and he listened. We ran a ton of tests. He helped me eliminate even more possible causes of why I have POTS. And we kind of sat down and we said, hey, look, he told me I tested positive. I keep testing positive for Lyme. My what is it? The ELISA keeps coming back at like 1.35, which is like really high. That's a really high marker. And then I'll have a band or two come back positive on the Western blot, or it'll be completely negative, or it'll be equivocal. So he looked at me and he said, "Look, man, you remember a bite right before you had a bite before you got sick? Maybe that's what caused it." And he had no idea to tell me how or why or what, or he just knew that I felt my tilt table. I think my heart rate was 48 when I was laying down, and when they stood me up, it got to 122. And then my starting blood pressure was like 136 over 80, and then by the 15-minute mark, my blood pressure had dropped to 90 over 30. So I almost passed out on that one. He also did an EEG and an EMG, I think. He did the brainwave study to check for epilepsy, which I passed that. That was fine. And then he tested me for like the needle, I can't remember which one, EEG, EMG, the one that tests for neuropathy. He said that I had that carpal tunnel syndrome or whatever. So, I do have really sharp shooting pains in my hands, and they were burning when I first got sick. They don't really burn anymore. And he really didn't have a whole lot to say about that. Pretty much told me that I could try a nerve block, which I'm not, and then told me if that didn't work, I could try surgery, which I'm not. My hands were the worst thing that was going on, and I wouldn't be making YouTube videos trying to figure out what's wrong with me. So I'm driving right now to Mayo Clinic in Rochester, Minnesota. I've been waiting on this appointment for about 7 months. It's about a 12.5-hour drive from my house. So I'm just starting the drive. I don't know if I'll drive it all today. My first appointment's not until Monday. Today's Saturday, so I've got, I can stay somewhere tonight and then finish up tomorrow if I'd like to. So I may end up doing that. But let's see. I have been tested. I think this is something that a lot of people with POTS need to hear. So most people that I've talked to have been women, and if you present with a more typical type POTS, you're heat intolerant, and a lot of people that I see that have POTS, their resting heart rate even is more close to 100, and then they'll get up to 140, 150, 160, whatever. So you would treat with classic beta blockers. Mine has been a little different, but all in all, no matter how your POTS presents, to me, I feel like you should really, in the midst of all the chaos that goes on with being sick like this and feeling as bad as you feel, I think it's important, especially if you're from a rural area the way that I am. We're very isolated from like modern civilization, and a decent fucking doctor. I think it's really important for people to, educate yourself. You can get on Dysautonomia International, you can get on Mayo Clinic, you can get on Vanderbilt's website, and you can start looking at all these different causes of dysautonomia, not just POTS, but dysautonomia. And then literally you can sit down with a doctor that you trust, that's familiar with POTS, and you begin the search for a possible cause. You can try for there are mitochondrial diseases that cause this, which I don't think, unfortunately, there's not a blood test for that. That would be like a muscle biopsy they would have to do, or like a skin biopsy. I can't think of what it's called. But there are things that you can be tested for that could cause POTS. Like there are infectious diseases like hepatitis and Lyme can cause POTS. Epstein-Barr, which is mono, you can be tested for mono. You could be the vitamin deficiencies can cause it, so you need to go have your vitamin levels checked. And then there are simple imaging tests that can help. Like physical trauma can cause POTS. So if you were in a terrible car accident or something like that, can cause POTS. So really think about it. Like, keep up your medical paperwork, and then look at the big picture. Because to me, like, this is just my opinion, but I feel like whatever causes your POTS, like each cause is probably going to present a little different, because each cause would probably affect and damage your autonomic nervous system in different ways, and damage other parts of your body. So for me, like, I've had really bad neuropathy. I have sharp pains all over my body, in my hands, on my feet, my head. I have migraines constantly. I have horrible brain fog. My stomach is like, I can't even explain how messed up my stomach is. And then I also have the typical presentation of POTS, so I can literally just sit down and stand up and show you the change in heart rate. But I've had all these different things. There's so many different factors that go into being diagnosed and how to treat and helping your quality of life. It's not all about the heart rate change. It's not all about passing out, or feeling like you're going to pass out. There's so many other things that come with this. So I'm hoping. I'm really hoping down here, because I want to say, like, I want to believe in the chronic Lyme thing. I really do, and I don't mean to offend anybody, because I might be I might be wrong. I'm not saying that I'm right. I'm not saying that anybody should even look at my videos and pay attention, or like treat yourself the way that I'm treating myself, or go through your journey the way I'm going through mine. Like, everybody's different. Everybody's severity is different. Like, it's okay. Like, I just want to help people. But I did the 9 months of antibiotics. I did the natural bullshit. I did the diet stuff. I did all that. I didn't get any better. Like, not even a little bit better. So, and I've even had a buddy who was in medical school. Like, this is a reach, but we looked at my blood under a microscope. Because I need to see physical proof. If I've seen it, then let's get it. Like, let's kill it. I'll do anything you want me to do. I've already talked to my wife. I was willing to go to Germany and get my body temperature raised to 106 or whatever it is, but it's inconclusive. I don't know. You don't know. You can say you can think because you've been on the dark web and you're on these Lyme forums, like, you've heard this and you've read this book and it's a government conspiracy. Like, it's fucking bullshit, man. Like, I'm not gonna say it's total bullshit. It could be, it could be. But for me, like, I'm sick as fuck. I've got kids to take care of. I'm having to retire from my job. And at one point in time, I was dragging my sick ass to work for a year straight. Like, I was trying to get better. I don't want to chase a ghost. Like, I need to know 100%. And here's the thing, is, like, it's sketchy as fuck. Like, you go out and you spend all this money on these Lyme doctors who don't take insurance. You don't take insurance? So, I was out thousands of dollars, and I did it. I did the little song and I did the dance, and I didn't get any better. So, I've been looking at something, and listen, like, I really can't express to you how important I feel that this is. There's a disease it's an autoimmune disease. It's called Guillain-Barré. And what Guillain-Barré is, and it's very acute, and it causes, it literally would cause somebody within a month's time to be in the hospital on a ventilator because you can't breathe. Like, it attacks your nervous system, and then most people just sporadically get better. Just get better, and that's it. There is a subtype. They think it's related to Guillain-Barré. I hope I'm saying that right. It is called autoimmune autonomic ganglionopathy. The abbreviation that's used most of the time is AAG. It used to be called pan dysautonomia, but what it is that's why. If you're anything like me and you have POTS, you've done a ton of research, and you look and you say, like, oh, like you hear these doctors like, oh, some doctors think that it's like POTS in itself is an autoimmune condition, and you think like, well, why would they? That's why they think that, is because they think that there's a subgroup of people with POTS who actually they have these antibodies towards the nicotinic acetylcholine receptor in your brain. Now, not the muscular receptors, because those are associated with myasthenia gravis. And there is a blood test for that. Now, like your local doctor won't do it. Quest won't do it. Quest will do it for the muscle antibodies. Do not get tested for that unless you think you have myasthenia gravis. The only place that you can receive this test for AAG, for autoimmune autonomic ganglionopathy, is Mayo Clinic laboratories. You don't have to go to Mayo Clinic. Your doctor can call and order these tests, or your doctor can ship these blood samples. But a lot of times, the smartest thing to do is call Mayo Clinic laboratories. It's a simple Google. Call Mayo Clinic laboratories. Tell them your name, the state that you reside in, and ask if there are any Mayo Clinic affiliated hospitals or doctors in your area. You may have to travel. I drove 3 hours for the test. The only downfall to the test is this: it's only 50% positive, because I guess they feel like the nicotinic acetylcholine receptor antibodies, they feel like are only one of the antibodies that could possibly cause pan dysautonomia or AAG. The other antibody that could possibly cause it is unknown. They don't have a test for, whatever. So it's only 50%, but it's worth getting tested for. So I urge people who have this to, like, really use your brain, really be an advocate for yourself. Take responsibility in your health. Like, I'm not saying it's everybody's fault that you got sick. I'm not saying that. I'm not saying I know why you got sick, but I'm telling you that there is a process of elimination that can help you get pretty fucking close to figuring out if there's a cause or if there's something that you can fix that will make you feel a little bit better. So you need to go do these things, man. Like, you need to start your list, keep your blood work, like, get tested for all that. Like, there are so many different things and there are things there's 20 things that I can't think of that I didn't name that can cause this. So it's very important, like, if you can talk a doctor into doing a spinal tap, like, tell them to check your protein levels. If they're elevated, that's a tell-all sign. You know what I mean? Like, that's almost they say with AAG, like, you will have protein levels that are high in AAG in your spinal fluid. My doctor actually, and I'll get back to that now. My doctor in Bowling Green, we did the MRI with contrast, and he figured out that I have cephalomalacia on the back right side of my brain. I can't think about what section it is. I actually have the paperwork in here somewhere in my car. I'm showing it to my doctor at Mayo. They don't know what it's from. He doesn't think it's related. He asked me if I had a stroke, but then the damage pattern on it was so small, and it was so clean. The edges were so clean. He didn't think it looked more from like blunt trauma. And I told him, I played football growing up, like from the time I was 4 to the time I was 19, I was playing football. So they said it could be because of that. My mom had told me that when I was younger, I had migraines really bad. She took me in for a CT, and they said that I had a dark spot, and it was probably because I was suctioned out when I was born. It could be from anything, he said. But I also had a syrinx on my spine. It wasn't very big. It was like 0.7 millimeters. He told me that he felt like the cephalomalacia and the syrinx, neither one had anything to do with why I have POTS. And it was pretty dismissive. Told me that if I wanted to address the syrinx, that I could go see a neurosurgeon. Warned me that if I had an operation to get it out, that it could be dangerous, probably not worth it. But what's interesting to me is this: a syrinx can only what it is it's a cyst. It's a cyst in your spine, and the reason that those form is because a blockage of spinal fluid. So a couple things can cause that. So you can have encephalitis can cause it, like just something cutting off the flow of the normal flow of spinal fluid. So I thought that was interesting. I thought maybe that was like a marker for something. Maybe it is involved. The guy in Bowling Green, he was a really good doctor, but I felt like he was so busy. I was driving 4 and 5 hours to see this guy, and sometimes when I'd get there, I was supposed to see him, and he was a no-show. I'd have to see his nurse practitioner. So I'm going to present all this down here to Mayo Clinic. I'm going to see what they think. I know that they're doing the autonomic testing, they're doing the sweat testing, they're doing another tilt table, they're doing an echo stress test. I'm doing, a ton of stuff. So all kinds of blood work. I'm going to talk to him. I've got all kinds of stuff written down that I'm going to ask these doctors. I'm trying to, with my approach, I'm trying to be very, very organized. I've learned a lot over the last year and a half, especially with dealing with doctors. I'm not going to hide anything. So I'm hoping for good news. I'm hoping that they can lead me down a path, or at least help me out with some medicine, because if you haven't watched my other videos since this started, before this started, I was in really good shape. I worked at a federal penitentiary, worked out all the time. My heart rate hung around 50, which it's always been low. I remember being in physical therapy from football when I was 16, and it being like 50 in the morning time, and the nurses there were kind of freaked out because it was bouncing from 49 to 50. But I've just always been in really good shape. So when this started, my heart rate started getting down to 32 and 33 while I'm awake. So not only has my dysautonomia caused POTS, it's also caused me to have bradycardia, which from research I figured out is actually pretty common. So but with that, I've been unable to receive any type of medication to treat me, because I guess your standard treatment is with a beta blocker. They like other medications that raise your blood pressure really aren't working for me either, because sometimes like my blood pressure is 145 over 90, and then sometimes it's 110 over 70. So it really varies with me. I haven't really been able to get any treatment. So the very first doctor that I ever saw with this had told me that maybe a pacemaker was something to think about, and I'm going to ask him about that down here, because ultimately, if a beta blocker is the only way I can feel better, and the only way I can take a beta blocker is a pacemaker, then I'm going to do it. For me, it's all about quality of life. I'd rather live the next 10 years and feel decent than the next 40 and want to fucking kill myself. Pardon my references, but I'm just trying to get better, man. Like, I don't care how I got to do it. I really don't care. But yeah, back to the blood work. Like, I've had so much stuff. Like, I've had my ANA tested for any signs of like autoimmune markers, and they're always negative. So we'll see. We'll see what this guy says, and then maybe I'm hoping I have enough time to make an update video after my trip. Maybe on my way back this Saturday, I'll upload this video tonight, and hopefully I can get some feedback with some stuff that you guys have done or that you've been tested for that I maybe need to be on the lookout for. Maybe we can compare blood tests, because I've had some stuff fluctuate. I've had, my TSH has dropped. I'm all the way down to like 0.65 on my TSH. So I'm right, like borderline for being, it's like the number's low, but it's high. Your levels are high. So my levels are very high. But as always, guys, thanks for watching. I'm sorry, especially if you subscribe to my YouTube page, that I haven't uploaded anything in the last couple months. I've just been busy and trying to get better and spending time with my family, man. And you look up and 6 months is gone. So see you guys.